Well, it's a one-stop shop for all orthopedic needs from diagnosis to recovery. And today we're meeting one of the new doctors who specializes in joint replacement of the hips and knees. Dr. Dustin Rinehart, orthopedic surgeon with TSAOG, Orthopedics and Spine. Welcome, sir. New to town. Welcome. All right. What is hip arthritis? When should a patient reach out to a doctor about the hip pain?
Hip arthritis is basically when you've worn out the cartilage, also known as the padding, in your hip. And now that ball and socket joint is basically bone on bone. I would say when your symptoms are so severe that you can't do things you enjoy, such as walking around the block with your pets, social activities with your family, or even simple daily activities like cooking and cleaning, once that pain in your hip is so debilitating, it's time to seek help.
So what are the causes? What are the risk factors involved with hip arthritis?
The causes can be a variety of issues. It could be an underlying diagnosis such as rheumatoid arthritis. It could also be due to a previous injury or fracture about your hip that can lead to what we would call post-traumatic arthritis. Or you simply may have worn out that cushioning over time, and now you have that bone-on-bone pain.
Okay, so then comes treatment options, and everybody thinks you have to first jump into surgery, but there's non-surgical methods too, right?
Indeed, surgery, believe it or not, is actually the last thing on our mind. We like to start with the conservative, non-operative modalities, so to speak. Simple things like heat or ice, activity modification using a cane. There are some topical anti-inflammatories or some medications we can try to improve that inflammation and pain before we go jumping to surgery.
Now, it will never get better though, right? Once you've kind of lost all that padding and the cartilage in there, it doesn't grow back on its own.
That is true. It will not grow back. The arthritis will always be going on in the background. It's just a matter of managing your symptoms.
So tips for then folks who are struggling with arthritis?
I would say my biggest tip is don't struggle. Come seek help. Let us help you manage it conservatively. And then if that happens to fail, we have a relationship and we can start talking about what surgery would look like.
Because a lot of people are like, oh, you know, I don't want to do surgery. But this is, I mean, these kind of surgeries are not like what your parents may have told you about or grandparents back in the day, right?
No, that's correct. And most people are surprised to hear that. In clinic, most procedures, hip and knee replacement these days, patients go home the same day. You are up and walking the same day. A small percentage stay overnight, but otherwise you're home very quickly.
Wow, really? That quickly up and walking on a new hip or
yes, sir.
Something like that. Okay, well, if you would like to book an appointment with Dr. Dustin Rinehart, orthopedic surgeon, of course, give him a call over there at 210-804-5400. And for more information on TSAOG Orthopedics and Spine, visit the website, tsaog.com. Dr. Rinehart, thank you very much. Appreciate it, sir.
Thank you very much for having me.